All right, we are back with Dr. Matthew Finn. He's an interventional cardiologist at CIS. He'll be in Houma and Raceland once again. That's important for everyone who's watching. You know, we're talking about symptoms and we're talking about difference in women and the difference in men. But I got to tell you, I think it's important for most people to listen to their own body. If they're so used of a certain way and all of a sudden something's not feeling quite right, that's a good time to go visit you, right?
Agree. I think ignoring things is a big problem, and especially around here, where there's a lot of, you know, kind of old-fashioned mentality that I'm tough, I can get through this on my own. But we want to help you through it. We want to make sure nothing very life-threatening or serious is going on, and you know, give you a proper evaluation. And we're not trying to mandate certain things to you. We're just trying to have a discussion, make you feel comfortable, talk about healthy things and healthy lifestyle changes. And then if there's a bigger problem that needs to be addressed, address it together.
When they come see you, what's the normal protocol? I've been there, I don't mind saying it, that you will go through a protocol. They're saying you to do different things, but that all depends, I guess, on what you see as a cardiologist that would make you put them in different directions.
Right. That's a great point. It does vary based on the presenting complaint or presenting problem. But in general, you're going to check in. We're going to get you back to our room. The nurse is going to take your vital signs, get a brief history of what's going on, very carefully go through your medications to make sure that we have everything accurate, check your recent hospital records, if there are any, other clinic notes, and then the doctor will review that, come in, and discuss you know, with you what your symptoms are, and then discuss possible testing and treatment that may be needed.
Yeah. You as a doctor, when you see somebody come in, are there factors that you look at that scare you the most, like or is there a combination of factors that makes you make the next step, or is there one in particular factor you're going, okay, you got to stay and we got to evaluate you more?
That's a great question. Yeah, the classic risk factors and the number of them really get my attention. So, you know, family history of early heart disease is one major one, and it's very common in this area. Severe high cholesterol at a young age is concerning. Tobacco abuse is still a big problem in our area. Mm-hmm. And so that always catches my attention, working with patients to try to help them quit in any way we can and support them through that. Diabetes is also concerning, particularly poorly controlled diabetes or brittle diabetes. Those risk factors, and then active symptoms also get my attention.
I'm not promoting drinking, folks at home, so I want to ask this question, but every 100-year-old birthday I go to, one of them 105 not too long ago, what's the secret? I have a highball. I have an aunt that's over 100, takes a swig of whiskey, does a whiskey sour every day. Is this some type of Drano, or you have other things that can, like Brilinta, I think, is a platelet thing where it stops the platelets from coagulating. There's medicines that can do that too, right?
Right. Low dose alcohol can, in some studies, be shown to reduce incidence of heart attack and coronary artery disease, but that's balanced with an increased risk of arrhythmia. So we generally say if you're not a drinker, don't start to prevent heart disease, but some alcohol in moderation may be advantageous for decreased heart attack risk.
And we're not condoning somebody opening a fifth tonight and chugging it. Just talking about a little jigger maybe or something like that. So you've been here for a while and you've seen the people of this area. They like to eat. They like to put extra seasoning on the food. They like to have a few beers with their food. If you really want to prevent heart disease, they're going to have to rein in a few things, right?
That's right. We typically recommend the Mediterranean diet for most patients, and a discussion over what dietary practices can be individualized based on other comorbidities. But in general, the Mediterranean diet has the most robust evidence for heart health. And actually, the Mediterranean diet's not that far off from the Southern Louisiana diet. It's very fish-based, but there are certain subtleties that are different, such as less fried food. So I think that a lot of individuals in this area can easily get to that diet with a little bit of discussion.
Yeah, and doesn't the month, the American Heart Month, doesn't it give people a chance to just check themselves and go, all right, I've been really neglecting my body. Let me just, if your foot hurts and you can't walk for a week, you're going to get it checked because you can't walk. Some people, their heart's feeling different and they have an angina, they don't know it. Just go see you. Go see the doctor, right?
Yeah, we would love to see you. And the purpose of this is just to create awareness and restart the discussion about heart disease and heart health.
And if somebody's watching, we have about 30 seconds left. If your loved one is having just bad days and they're feeling bad, they're not feeling quite right, make sure that you go bring them, get them checked up. They may hate you for a couple of days after. They may check out fine, but they'll get over that and they'll love you more for doing it. So, Doc, we appreciate you coming on. We appreciate what y'all do. Good to have y'all right here in the area. And I've always said it, it's great to have such a great institution right in our backyard. So it's not like we have to go to New Orleans or Baton Rouge or everywhere else to get a checkup. We do it in our backyard. So thank you.
Thank you. Thanks for having me. And I'm proud to be a part of this community, proud to be at CIS.
All right, Dr. Matt Finn, we'll see you around the corner.
Thank you.
Today's social media segment is brought to you by South Louisiana Bank. It's better when we bank together. Waits and Downer, attorneys at law. Terrebonne Ford, built Ford tough. Alford and Associates for all of your insurance needs. CIS, Cardiovascular Institute of the South, the highest quality cardiovascular care available. Barker Honda, the Barker family tradition of quality. Terrebonne General Health Systems, modern technology and timeless caring. Rouse's, you're either local or you're not. Buick, the craft of modern luxury. St. Martin and Bourke, know your rights. All right, welcome back to Bayou Time. I'm Martin False, and it's the American Heart Month. And God, can we have a Heart Month without having CIS right here in the area? It's great to have CIS here, and we can always get great doctors to come on and talk about not only during the month, they're here all year long, but we want to focus because it is the month. And Dr. Matthew Finn is back with us. He's an interventional cardiologist at CIS. Doc, good to see you again.
Thanks for having me back.
Yeah, I'll tell you what, you've been busy. I see you speaking at some ceremonies y'all have, and you do a great job. Once again, February is American Heart Month. Cardiovascular Institute of the South wants to educate our community on the prevalence of cardiovascular disease and the importance of prevention. So let's get right into it. And kind of the most obvious question is why we should be concerned about cardiovascular. And I know you're going to sort of tie in our South Louisiana living a little bit, but we do have a lot of reason to be concerned, don't we?
Well, yes, heart disease remains the #1 killer in the United States, ahead of all forms of cancer combined in most years. So it's still extremely concerning, despite our best efforts to this point.
Yeah. Now, we always talk about cardiovascular just in the heart, but we all learn as we get older that when you go for a checkup, sometimes they check in your limbs and everything else. So it's not just the heart, is it?
That's exactly right. That's why we call it cardiovascular. So in addition to the heart, we're concerned with the peripheral circulation, the arteries and veins, which I know you're familiar with.
Yeah. So peripheral artery disease, when we talk about that, can you give us a little detail on what that entails? And for people who've never had to go through that, what can they expect?
Yeah, so there's peripheral arterial disease and peripheral venous disease. Peripheral arterial disease is the blood flow typically described outside of the heart that brings blood to the rest of the body. Most typically, patients complain of symptoms in the leg, difficulty walking, cramping, burning, pain when they walk.
And we got to be careful with that because anyone who knows, and I've had some back problems before, a back problem, especially if you have claudication in your back, it can mimic the vascular. So I guess as a doctor, sometimes y'all got to sort of say, okay, whether or not it's a back problem with a pinched spinal cord or if it's actually the heart or whatever.
Yeah, and to make things more confusing, sometimes you can have both. So it comes down to an assessment by, your provider to determine what exactly is going on. Things as simple as a physical exam, feeling the pulses can help determine, whether peripheral arterial disease is the major cause of the symptoms.
Yeah, and you talk about symptoms a lot. Before I say that, I want to also mention you're in Houma and Raceland now?
That's right. That's right.
You're
Both
doing
clinics.
double duty? Yeah. Well, you're covering the area.
Someone may say that, yeah.
Yeah, y'all got so many areas to cover. But that's good, though, because people got some great people in the Raceland area, and they deserve, great coverage as well. You talk about symptoms. Are there multiple symptoms that people need to look for? Can you just have one?
So when we talk about for cardiac symptoms, there's a wide variety of symptoms ranging on what the problem is. Most classically, we talk about anginal symptoms, which is chest pain with exertion. But in coronary artery disease, it can often be much more subtle than that, such as shortness of breath or fatigue. Sometimes palpitation, dizziness can be other manifestations of cardiac arrhythmias or abnormal heart rhythm, or also valvular disease.
Mm-hmm. You say that just ironically the other day, one of my friends said, I'm having a funny feeling here and I'm having a sharp pain in my back. You think it's my neck? I said, well, if I were you and I directed him to give you all a call, the safest thing to do would be get it checked, right?
Yeah, we would love to see you. If you have any of the symptoms that we described, please come on over for an evaluation.
Yeah, so you talk about, and those are some of the things that are confusing to a person who is having, like if you have chest discomfort, if you read on the internet, they'll say, yeah, like an elephant standing on your chest or whatever. But is it always that obvious?
Definitely not. It can be much more subtle. And we also want to catch it early. So before you have severe symptoms like that, like I said, symptoms like shortness of breath and fatigue could be subtle manifestations, palpitations. And patients with diabetes, females often have atypical symptoms. So if you have risk factors that may trigger concern, then you should seek evaluation.
All right. So, the typical things I've always heard now, and I guess before I forget, is the symptoms different in males than females?
They can be. Women classically have more atypical symptoms, which may be fatigue, shortness of breath, palpitations, things like that, dizziness even. And women tend to be undertreated due to the lack of classical presentation.
Yeah, that's a disadvantage. So I guess that would be why you should have a regular checkup.
That's right. And we talk about risk factors that may be concerning. We talk about things like smoking history, diabetes, family history, which in men is a heart attack in the family in somebody less than 55. Women, a female relative, first degree relative, like a primary parent with a heart attack less than 65 in women. Also poor diet, sedentary lifestyle where you don't do much exercise. Those things may prompt you to just seek an evaluation.
Yeah, and that's always good to do. Let's do this. We'll take a short break. We're going to come back with Dr. Finn. Don't forget, it's just wise. Just set an appointment if you're having any kind of indication that you're just not feeling the same as you used to. And chances are it may be nothing, but if it is something, you catch it early. We'll be right back. Part 2. Don't go away.